Well, John, what about you? You've been in the NHS as a doctor for a very long time. I know quite a few myself. They're often knackered, they're exhausted, but something keeps them going back. And I'm just wondering what it is, given the level of dissatisfaction, given the longest strike in history starting today.
Well, I mean, there are so many parallels with education. And the problem with the workforce plan is that, first of all, it didn't really look at what's needed in terms of safe staffing across all specialties. But it doesn't address the problems of retention. There's 170,000 people left the NHS last year. Now, not all of those are doctors, a minority are doctors, but you have 40% of junior doctors who are saying that they're thinking of leaving. If you actually look at the figures in New Zealand and Australia, something like 42% of their doctors are trained overseas. If you look at their nurses, 20% of nurses in New Zealand are UK trained, 25% in Australia are UK trained. So health staff are voting with their feet, and the experienced staff are going, they're being ground down. The GPs, about a third of them are saying that they want to take early retirement. And unfortunately, the workforce plan doesn't address the real crisis that was identified by the Health Select Committee last year, that the NHS is in its worst staffing crisis ever. And of course, without staff, the NHS can't function. And without adequate numbers of staff, it can't function efficiently. So you have to do something about how you stop people leaving. And a decent pay rise would be a big part of that. And that's just being ignored.
Yeah, that's the voice of Dr. John Puntis, co-chair of Keep Our NHS Public. He is a retired consultant paediatrician, so he knows what he's talking about. And Sammy Wright, he was the other voice in that discussion, apart from mine.